Hello students, good morning. Today we shall start with Unit 7, which deals with the management of patients undergoing surgery. As we have already discussed about this phase a little bit in between while we were talking about the operating theatre room, like when the patients come in. Now, as you have seen it during your clinical postings as well, there is a lot of preparation that goes into this kind of aspect where the patient has to be prepared prior to the surgery, and even during the surgery, just before it starts, there's a lot of preparation. Then the surgery goes on, and once he's after the surgery, again there's a lot of care and management that goes for that patient. That is the post-op care, and then the patient is then transferred to the wards for further observation and management. Now, this is actually classified into three phases when you talk about the care of a surgical patient, and that includes the preoperative phase, intraoperative phase, and the postoperative phase. So, what happens in the preoperative phase, even during your clinical postings, even though you have not done it physically yourself, but at least you would have observed your senior staffs, the way they doing a lot of checklists preparation, and the patient's folder has to be neatly organized with all the investigation reports, the x-ray reports, and the medical reports, any other prior or previous surgical reports, whatever is there or has the patient has had previously, all has to be compiled properly, along with something called as the consent or the permission from the family that yes, we can go ahead with the surgery. So all these documentation is very, very important during a preoperative phase, which is nothing but prior to the surgery. And so the nurses have a big role to play during this, and a lot of preparation goes on with the patient aspect, and also from the nurse's point of view as well. And along with preparing the family for this, what is it, procedure, and it's very important how the family is able to what is that, get themselves mentally prepared of sending the patient in to have this procedure done. So the nurses have a big role to play, and not just the nurses, along with the healthcare team, which includes your treating surgeons and the anesthetist, the medical ward doctors, everybody for this matter will interact with the patient and the family, and they have to convince the patient and the family. Rather than convincing, it's more about educating them about what actually the patient is going in for. So this is very, very important. And along with the intraoperative phase, what happens there is the roles of the operative personnel. When I say the operative personnel, it means totally the operation theatre staff. So it includes the entire medical faculty there. So it includes, when I say medical, or rather, I can put it as the healthcare faculty, which includes your the nurses, the doctors, the treating surgeons or the physicians. Everybody is involved in this care of the patient and during the procedure, and until the patient comes. And it also involves the, what is that, the anesthetist, the anesthetic nurse who's assisting the anesthetist, or who's looking after the patient who's being anesthetized. And that falls under the category of the post-operative management. So once the patient comes out, again there is and that also includes the recovery nurses. So recovery nurses, or the recovery bay or the recovery area, is nothing but where the patient comes out of the operating theatre room after the procedure is being done, and where he actually recovers. Rather, he is actually, since he is unconscious, now he has to wake up. So, and the nurses also have to ensure that he is completely stable. All the parameters are right, and he's stabilized. He's responding well. He's oriented. He knows where he is, and he knows what has happened to him. So everything is very normal with the patient. So once the nurse and the treating doctors and the anesthetist is satisfied with the way the patient is post-op, that is after the surgery, then only the transfer from the operation theatre to the ward, or from where the patient came from, be it the ICU or the critical care unit, or back from the medical ward or the surgical ward. So it has to video. And now in this slide, you see that in something mentioned as the perioperative period. So this entire phase, which starts from the preoperative phase, intraoperative phase, and the postoperative phase, is called as the perioperative period. So basically, this is exactly what I explained to you. The preoperative phase includes a lot of preparation, which involves both the physical preparation as well as the psychological preparation for the patient and the family. And from the nurse's aspect, it involves a lot of documentation work and preparation or sending in the patient for surgery, which includes compiling all the records. And very important is the informed consent, which I have always spoken to you about. And it is a very important document. It has to be done especially in an elective surgery when it is being performed, and the patient and the family has to be thoroughly for the procedure, rather than no doubts has to be in their minds. It should be completely clear. So whatever we're dealing with, there is absolute transparency in our actions. And the intraoperative phase is what you see, what happens in the operation theater room. And the postoperative, as I always mentioned, is you're recovering the patient. So mainly you're looking at if there are any chances of complications. So we should not let that happen. So the whole idea is preventing the complications from occurring and recovering the patient well, and then sending the patient back to the ward or the ICU from where he came. Now, the nurse's role in the preoperative phases, I've actually given it to you step by step. It involves the preoperative assessment. So you have to, depending upon your patient, whether he is a diabetic or he's a hypertensive patient, depending on all that. So it's very, very important. The patient is the patient is aware that yes, he's going for surgery tomorrow, and about his diet pattern, when he should be eating, how many hours he has to be fasting for prior to the surgery, and when should be his last meal. So all this is a responsibility of the nurse or the ward nurse or the treating nurse to explain to the patient and the family of when he should be having the last the feed before actually going in for surgery or the operation. And it is mandatory that at least we need a minimum of 6 to 8 hours of fasting, or nil orally is what we call. So all this has to be again documented in the patient's notes. The next important document is about, before this, prior to this, we should also be very thorough about the patient's medications, okay, being his diabetic, whether he's having his medications, checking his blood sugars, and then planning whether he's supposed to have his insulin, and, depending on that, whatever the diabetic the instructions by the diabetologist. So all that has to be thoroughly followed by the nurse, and then the patient has to be prepared and sent. The next important thing that you would prepare is the informed consent, which is this is exactly what I told you again. It is a document, or it's an important document or a form where the surgeon or the treating physician, along with the patient's family, and if the patient is in a position to understand and sign, yes, then he is more than welcome to sign. If not, a family member, the very next to kin, can also sign the document on behalf of the patient, and this has to be done even before the patient is actually wheeled out of his room to the operating theatre, which means the nurse has to take this form and document, and it has to be filed in appropriately, and then it has to be handed over to the operating theatre room nurse. So once the nurse there is looking into it, she will also be checking about all these parameters, or the checklist is very important. For what she will look into first is, yes, she would check the identity of the patient. Yes, is this the right patient that we've got? Is this a patient's hospital number? That's very important to check. Has the patient got any allergies? Is very, very important. As I've always mentioned to you, that it's very important to label or document about the allergies of the patient, and also the patient will be having a different colored ID band. So again, this is not mandatory that you have to do this. It all depends upon the hospital protocol, how they are aware of this kind of situation. So most of the hospitals, what they follow is the patient always has a clear ID band on his wrist and on his ankle. Apart from that, they would use a red band which indicates the allergy, which is very, very important. So then everybody, the treating doctors and the treating nurses will always know, yes, this patient has got some allergy to something, and that is the reason why he's wearing this red color banned. So you would go back and talk to the patient and check with him what is the reason, and then you would realize that yes, he's allergic to something. So this has to be kept in mind, and based on that, you will be administering medications to the patient, which is very, very important. Now, the preoperative teaching. Again, this is done by both the treating doctors, physicians, as well as the medical ward medical doctors in the wards, and also by the nurses from the nursing aspect as well. So again, when it involves the pre-operative and teaching, again, it's the complete preparation of the patient. So you would be telling him right from the start about, as I told you, what is this procedure for? How is he going to get benefited from this procedure? And yes, when we are discussing this, yes, we need to tell the patient also about the complications, because as I mentioned to you, the transparency is very, very important. So every information has to be clearly given to the patient and the family, and it's more of the patient's benefit from having the procedure done. And we know, yes, always something is always going wrong, or there are chances of complications to occur, but yes, we will look into it, and our team is full-fledged and efficient enough to overcome all these complications. But it has to be thoroughly explained to the patient and the family. Also, the preoperative teaching will include about the patient's condition, as I mentioned to you, if the patient has got any comorbidities. So how do we deal with that? His medications on time, his blood pressure medication. So when he is supposed to have it, what is supposed to do? All this has to be discussed with the doctors, and it's very important about the investigations. So investigations will include, yes, definitely the complete blood profile. It's very important to have the serum creatinine report handy, and if he's a cardiac patient, heart problems. So such patients also should have a cardiac enzyme report. Definitely the troponin levels has to be highlighted. So all these are very important aspects. And if he is a patient with any kind of respiratory symptoms, especially, yes, an X-ray is very, very important. So these are all and all this will be actually recommended by the doctor. So that yes, these reports should be handy before the patient is being sent to the operating theatre room. So it is up to the ward nurses and the ward in charge is to ensure that yes, these reports are ready, the patient has been sent for these investigations, the reports have been collected, it has been filed appropriately, and then send the patient to be OT. Next, the physical preparation of the patient, again, it depends upon, yes, what the patient is having the surgery. And yes, for example, I would tell you that if the patient is going in for a coronary angiogram, which means that, yes, the patient procedure can be done via the groin. So when you say the groin, or these days again, the procedure can be done from the wrist as well. So in case of the doctors still prefer, yes, going via the groin is better, then the preparation of the skin prep has to be done, shaving, and also making sure that yes, if, for example, as I told you when I was dealing with the ECG and preparation of the patient. So if the patient's chest is very hairy, it's important that we ensure that the chest is being shaved, so that the nurses are able to stick the electrodes properly. So all these are the general preparation. And also in case of the yes, another preparation would be, yes, you should have a shower in the morning, wear clean gowns, and ensure that, especially in case of women, then ladies or young girls, again, no nail paint, all that has to be removed. So all these are kind of preparation that you would do for the patient, and and along with that, as I told you, these personal identity tags are nothing but the wristbands. They're also very, very important. So the nurse has to ensure that all this is there, and has to be sent. So before the patient goes and is being wheeled in, yes, he should be wearing a cap and a clean hospital gown. Make sure the area to be where the surgery is being done is also being prepared and ready, along with the psychological preparation of the patient and the family. Now, coming to the pre-operative care, it is nothing but it refers to the health care which is provided prior to the surgical operation. And the main aim of this is to nothing but prepare the patient mentally for him to encounter with the scenario, which is nothing but just so that he knows what he is going in for. He should not be just wheeled in, sedated, the procedure done, wheeled out, and again he's recovered, and then he doesn't know what has happened to him. No, that should not be the case. So always everything should be clearly explained, and everything happens only with the consent of the patient and the family. So if the patient says yes, only then the surgery will be done. But it's up to the healthcare team to educate and to provide the adequate knowledge to the patient and the family. Tell them about what the advantages are, why we are doing this, what is the necessity of doing this particular procedure, and what can happen during the procedure as well as after the procedure. What the patient has to do to make himself better after the procedure. So all this has to be explained, and thorough education has to be given to both the patient and the family so that he knows what he's going through, and yes, he knows that this procedure is certainly going to make him better. So this is what is the care. Now the physical preparation, again, as we mentioned, we just told you about how the skin prep. Again, as also I told you about the nutrition and the fluids. So that means when he should be having his drink or the meal, and then there's a period of fasting prior to the surgery. Again, ensure that his bowels are empty. His hygiene, as I mentioned to you, clean. He should have a shower, wear clean gowns. Finally, the hair cap has to be put on. Sometimes what happens is the doctor will prescribe a small, sedative. That is nothing but to calm the patient. So maybe it would be written in the patient's notes, and this can be administered from the ward itself, or can also be administered once the patient walks in or comes into the operating theatre room. Sleep, which is very, very important, that he has to have his adequate rest. So his last meal may be like about 7 the previous night, and then he has a good sleep until the next morning. He wakes up, he showers, and also very important to care the valuables of the patient. So ensure that everything is kept in a safe place, in a locker. It is being put into a bag labeled with the patient's hospital ID, put on it, put into the locker, locked it, and then maybe the keys are handed over to the patient's family, or it has to be kept with the nurse in a safe place. So all this is also very important. And in case of dentures or anything the patient is wearing, then maybe if the operating theatre room requires that, yes, it has to be removed, because obviously the patient is going to be anesthetized, or maybe he's going to have an endotracheal intubation. So the dentures has to be again removed and has to be kept. And anything for that matter, the patient has got some kind of a prosthetic, then all that has to be removed and kept safe. And surgical skin preparation, any other special orders which is told by the patient, doctors, that's what I mentioned by telling, maybe he's asked for a special investigation and report. So all this has to be up to the nurses to keep it ready. Very important to look into the safety protocols of the patient. Important to record the vital signs just before the patient goes in, and also wearing the stockings. And that is again to take care of the circulation, because even after the surgery, the patient is going to be in bed for a while. So we don't want that circulation to be hampered. So putting on the stockings is also very, very important. The preoperative medications, as I mentioned to you, is some of the patients may feel nauseous. So again, giving antiemetics, and also sedatives, anticholinergics, and also antibiotics. So these are all, again, this is not mandatory. Again, it depends upon the patient's condition, and also the treating doctors, what they prescribe. And anticholinergics, again, it's nothing but it takes care of symptoms where the patient can start to feel having a dry mouth and urinary retention, increased heart rate. So all this is nothing but just to calm the patient down and ensure that even the body functions are also in a normal way. So it could be prescribed and it may not be prescribed. So it depends entirely about the treating doctors. So whatever instructions and orders we have from the surgeon or the treating physician, it has to be followed appropriately. And the thorough investigation report, along with all the investigation reports, has to be filed in and compiled appropriately, and the patient has to be sent. So this is a thorough check done by the nurses before, while the preparation is going on, to ensure that yes, all this is being done, it is documented. Yes, the final blood sugars are being checked, the blood investigation reports are also there, and then this now the preoperative test, this is exactly what I told you. Maybe the patient being recommended a complete blood count. You need the chest x-ray, random sugar, serum creatinine, ECG, blood grouping, cross matching, which is very important, especially when the patient is going for an open surgery, because we do not know what happens. So everything just to be handy. We do not want any kind of transfusions happening, but they take the extra care to ensure that yes, there is no loss of fluid, or just to make sure. But in any case, in something like that happens, then we know yes that we have a bad investigation. So complete blood count, blood urea, ECG, investigation reports. Now, so much is about the preparation. So once this patient is being handed over to the operating theatre room nurse, then what happens? So what goes there is, yes, the patient is handed over, the nurse there will check the patient. Yes, first of all, checking, yes, if this is the right patient, has he got, which ward did he come in from, what is his age, what is his date of birth, and what is the hospital ID number. So everything has to be thoroughly checked. Ensure that the patient has got the ID bands. Along with, yes, is he allergic to anything? If he's allergic, then yes, has he got any kind of indicator bands for that? So that is also being done. Yes, has the patient had a shower? When did the patient have his last meal? How many hours of fasting was that? Did he drink any kind of fluids before that? Has he had any kind of pre-medications or sedatives prior to coming from the ward into the OT? Yes, so all that. And is the area to be operated being prepared? So the nurse physically checks before the ward nurse actually goes back. Yes, it is being prepared, and ensuring that, yes, has, very importantly, has the patient sign the informed consent form, which is very, very crucial and important, and has the patient and the family being explained about what is going to happen for the patient today, and is the patient well and truly aware about the procedure, what is to be done. So all this you're going to be very casually discussing with the patient, and just to ensure that, yes, he understands and he's thoroughly for it, and also he's calm and content. So that's what you say, and you just make them feel relaxed. And once a patient comes into the operation theatre room, you just monitor him, you just hook him up to the monitor, ensure that he's stable. You're checking his blood pressure, his blood sugar. You're also going to be checking, because when it was last done, what is the result, along with an ECG report, if I think, along with the investigations, very importantly, the serum creatinine, and as I mentioned to you, if he's a cardiac patient, very important about the troponin levels and the cardiac enzymes report. All this is also very, very important. So you do all that at the reception area. You just check the patient once he's being received into the receiving bay, and the nurse puts the patient into an comfortable area, gives them privacy, and then carries on with her activities. So much is the initial preparation, and then the ward nurse then goes back. Maybe after that, what happens is the patient will be visited by the anesthetist. So once the anesthetist walks in, he's going to be talking to the patient, and again, the same questions will be asked by the anesthetist, because he needs to ensure that he is dealing with the right patient. So he will be again confirming all the patient identification details, checking on his allergies. Is he aware of the procedure? What is going to be performed today? Has he received any kind of sedation in the past, or has he had any surgical operations in the past? And did he react to any medications? That means, was he allergic to anything, or did the surgery go on well? Did he face any complications during that surgery, even during or after? So all these questions has to be asked by the anesthetist, just to ensure that what he has to be prepared for, even during this kind of, in this particular surgery as well. So just to ensure that no complications occur, this goes on smooth. So the anesthetist also makes his role of asking these information from the patient as well, just to know him better, so that he also knows what he's dealing with today. Then, once it is done, he will also check if the patient has had any pre-medication. So that is what I meant by saying pre-medication is nothing but trying to calm and sedate the patient. So before the surgery. So if he's received it, then that's good. So maybe he'll be putting him there. Again, he will look into the consent form, whether it is signed, which means that he understands that for this procedure, is it only just mild sedation which is being given by IV, or will he be having a general anesthetic? So that means he's being completely sedated. So that is also being explained thoroughly. The anesthetist also need to explain to him what all will be done during the surgery by the anesthetist. So all that has to be explained. That maybe his breathing will be under control. He'll be monitored, and adequate fluids will be given to him with as IV infusions. And what is that? Once he's out from there, yes, he may feel a bit disoriented. That is normal, and that's all because of the sedation that he's had. And this happens actually as I mentioned, after the surgery. So basically, in the recovery area, So what happens there? You have to explain this also to the patient. So the anesthetist's job is to just to ensure that he is clear from his end about what he does, and even during what happens to the patient, what is expected by the patient. So all this so that the patient also knows once he is aware coming out of the when he's coming out of the what is that recovery area, he knows yes that yes he was what's kind of disoriented, he was very drowsy, he was sleepy. All this is expected because, as I mentioned, because of the anesthetic drugs and he's had during the surgery. So this is all explained very thoroughly to the patient, and also very important to tell the patient about not to worry about his pain, because all that is being going to be taken care of, because they will be giving him morphine and just to make sure that he's comfortable. So all this will be under control. And so this is how you would calm the patient down prior to the surgery. So the patient also has that confidence. Yes, the person knows what he's talking. He's there to look after me, and I'm not going to be in any kind of pain. So that is what happens next. That also the intubation, as I mentioned to you, also happens, and the maintenance, as I told you about the fluids, the muscle relaxants, the sedatives, everything is under control and done by the anesthetist. Next, what happens after, and also maybe as I told you, the ventilation, the taking care of the respiratory aspect. So maybe had to be put on a ventilator. All this is not going to be known because the patient will be very well sedated and he's not going to feel anything. So we ensure that the patient is calm and comfortable, and then only ventilation, the endotracheal intubation is done. And even after, in case if this is being thoroughly explained to the patient prior to the surgery, so the anesthetist will also explain to him, like after he comes out, when he's in the recovery area, when he wakes up and when he's conscious, then he might start to feel a kind of sore throat. That is expected, especially when you're having an EP tube inserted. And later, when it comes out, you're going to be feeling that clogged feeling again because of the gel, and you'll feel a bit of pain, like a sore throat, which is normal again. So all this has to be, because the patient should not be anxious or apprehensive about why this has happened suddenly. So all this has to be thoroughly explained prior to him going in for the surgery. Yes. Now this is done. The patient, when the surgeon arrives, yes, he's ready. The patient is then wheeled into the operating theater. Also, as I told you, monitoring is very crucial. Again, for this, if he's going to have any kind of what is that, open wound, like open surgery again done, then very important, the blood gases also has to be monitored. So the ABGs has to be done. Again, we need the a nurse dedicated for running and getting this test performed as well. So even the anesthetic nurse assisting the anesthetist has to be very well and truly aware about this particular patient, what he is going in for, what are her roles, and what is she expected to be doing. She should also ensure that all the equipments are ready for the anesthetist as well, while him performing the sedation aspect. In case if he needs the patient to be intubated, the nurse has to ensure that all the equipments are ready. She needs to check prior about the laryngoscope, the blade, if it's working, the torch, the bougie, everything. What you the sizes are available, the endotracheal tubes, the different sizes are available. The anesthetic machine is well and truly checked. So all this also is the roles of the nurse, which she has to do prior to the patient arriving to the operating theater. So this is the roles the nurse has to play. And again, the maybe most of the time what happens is the anesthetist, or the anesthetic nurse again, maybe even after the procedure, maybe she's the one again recovering the patient as well. So that can also happen depending upon the staffing. So that truly depends upon the department protocols and the what is it, the general routine, what happens there. So for that also we have, but otherwise also we have dedicated recovery room nurses, again, who's full-fledged and skilled in looking after the post-op patients. So again, so this is what happens operator. Now the post-op, again, as I mentioned to you, now once the surgery is done, it's over. The patient is again wheeled out of the room and then brought into the post-anesthetic care unit, which is PACU. And there again, the nurse has to be thoroughly knowledgeable about what is expected out of this patient, because she should know what the patient has had. She should look into the patient's wound, check if there's any kind of bleeding or any drains attached. What is the actual drain that is out now? Is it have they recorded the amount of fluid that actually has drained out? How much of ml is it? All this has to be documented well and truly. She needs to check the wound is neat. There is no swelling. There is no. It is not bleeding and the sutures are intact, and the patient is also still under sedation. He's not, he should be in kind of a recovery mode, but he should be slowly waking up. But again, how much of pain he feels, and the recovery nurse also should take the responsibility of expecting the complications that can occur, as in the respiratory complication, which is nothing but the atelectasis, which is nothing but the collapse of the lungs. Again, that can happen maybe, not that it's expected to happen, but she should be aware of these things. Again, if there's any kind of situation where there is a pulmonary embolus that occurs, any kind of that all the, so depending upon, she should know what she's monitoring, the respiratory rate, the saturation, the ABG is very, very important. And also regarding the cardiovascular complications, the gastrointestinal complications, the genitourinary complications. Again, if there's any kind of definitely the patient is going to be having a urinary catheter, so again she should monitor the output, the volume, and the color of the urine. So all that, we know what is expected to be noted, and everything has to be documented. And very important, the hemorrhage, as I told you, checking the wound. So are the sutures intact? Is there any kind of bleeding? And does the wound look clean? And is the plasters or the dressings intact? Again, all that is, and is it clean, and does it need to be changed, or is there any kind of ooze or bleed? All that has to be checked as well. And make sure that there is no room for any kind of wound infection. So even while the recovery nurse is handling the patient, she should ensure that she's wearing sterile gloves, and making sure she's wearing the mask, the cap, and the recovery room gown as well, just to ensure that there'll be no kind of, she's not contaminating herself, and also contaminating the patient as well. Also looking for any kind of complications, when I said, is the wound dehiscence and evisceration. So dehiscence is nothing but where the surgical wound actually splits open. So that is called as the dehiscence. So there should be no chance for that, or no room for that. So that also has to be checked thoroughly. And also something called evisceration. Evisceration is nothing but through that, once a surgical wound opens up, maybe some of your internal abdominal organs can protrude out, so it can be seen. So we should also be expecting such things. That's all because of the high pressure, or the patient has been thoroughly hyper active, and he's, because since maybe he's like in his that sedative state, maybe he's not totally aware, or he's not totally oriented, or he's not totally conscious. So he can be moving around, he doesn't know what he's doing, he may be he doesn't is not aware about that this particular surgery has happened, and maybe because of his movement or something like that, maybe it can split open, and again, so the organs can protrude, or things like that. So all this is what the recovery room nurse has to be aware of. So for that, she should ensure that, yes, for the immediately once the patient comes out, yes, at least for the first hour, yes, he needs to have thorough sedation, and also the pain has to be under control. So making sure that the anesthetist has prescribed the appropriate drugs for taking care of his pain, and his the consciousness as well. And slowly what happens is the patient will begin to wake up, and you will also be assessing the patient from the point of view of his pain as well, and how comfortable he's feeling, checking if there's any kind of pain or abdominal pain, telling him that yes, he's trying to make some noises or sounds, that yes, the patient is slowly waking up, and he's trying to come back to his oriented form. So that is how you would start talking, and his conscious states. Now, the post-operative phase again is nothing but admission to the PACU, which is nothing but the post-anesthetic care unit. Very important that you, especially as I told you, when the patient is being intubated, very important to maintain the airway, and making sure that the patient, there's no tongue fall, so that the airway is open, the patient is breathing better, and he's in a proper position. And then, slowly when the patient is waking up, then the airway and all that can eventually come out. And then monitoring the vital signs, very important. Assessing the effects of anesthesia, that's what I mentioned to you. So the recovery room nurse should be thoroughly knowledgeable and skilled about assessing these complications and situations, providing pain relief, and providing him in a very comfortable position. Ensures again that and also talking, and what is that, making the patient feel comfortable that yes, the surgery is being over, it's gone very well, and the patient has been good enough on the table. He was very just giving him that assurance that everything has gone well, and now he's in the recovery area, and he's again slowly waking up, and he's expected to see the wound or the dressing maybe where the surgery is being performed. So do not be surprised about that, and maybe, and also making sure that he does not pull out any tubes. All this is going to be slowly and explained by the nurse as well to the patient and everything. And also the nurse will be telling once he is completely awake, yes. Maybe in a few hours from now, once he's completely awake, yes, he can have some food. That is also very, very important, because the patient has been fasting for a long time. Yes, he's going to be eventually feeling hungry, and yes, he is being supported with fluids for the moment. IV infusions are on, so that's going to take care of his fluid levels in the body. But again, he may be craving to eat something. So again, all this is what the mild and the general information that, or just to ensure that the patient feels comfortable, that the nurse will be talking and explaining to him. Also, very importantly, once he goes back here, all most of the instructions, the recovery nurse will not be talking to the patient and giving, because we should realize that the patient has actually had a sedation. So complete post-op care instructions, we cannot afford to give it to the patient directly. Rather, what happens is, once you know that yes, the patient has been in the recovery for maybe an hour or a couple of hours, and then what happens once he's or sort of awake, and he's stable, then what happens, his parameters are all looking good, everything is okay, and he looks stable for now. Then the nurse decides, yes, the patient can be shifted back to the ward or from the unit from where he came from. So then the ward nurses will be informed, and the nurse would then come up to collect the patient. So once the nurse is there to collect the patient, then all this post-op information, or rather the post-op care instructions, rather, you would be giving it to the nurse looking after the patient. So what happens is, you tell the nurse thoroughly what has to be done by the patient, and you are going to be exposing and showing the patient the wound, the site of operation, what it looks like. That is, he's got a drain, this much is the the output. He's also got a Foley's catheter, that much is the output, and everything that is documented is being given. These are all the medications that he's had during the surgery. This is the amount of fluids that he's, or IV infusions that he's had during that particular surgery. And maybe in any cases, yes, we had done ABGs during the surgery. So this is the report. And the patient was also intubated, but now, yes, he's also been extubated as well. He's feeling good. His parameters are all good. His ECG looks good. And so you give a complete handover about the patient during the surgery and during the recovery phase to the ward nurse. And then also you tell the nurse about what the patient is expected to do once the patient gets back to the ward, about whether he has to be remaining still for a while, still for a few hours in bed, and only then ambulate. And when can he have his feed? All this kind of instructions has to be. And what are the maybe the medications or the prescriptions that is being given by the doctors to be followed once the patient is in the ward. So all this is being done by the the OT nurse to the ward nurse, and only then the patient is being handed over. So this is exactly what I'm explaining to you: the post-operative management, care of patient immediately after surgery. And this is also being explained to you, as I told you, a very important nurse's role is to monitor the vital signs, the airway, the neurological status, how much he's conscious, aware, oriented, assessing the surgical site, maintaining the fluid and electrolyte balance, and also providing a thorough report of the patient's status while he was in the operating room, as well as once he's out in the recovery area, and until the patient actually gets moved out of OT. So till that the report is given to the ward nurse looking after the patient is sent back to the ward. So this is the roles and responsibilities of the nurse during the perioperative period. Thank you for your time.